Chicken, lettuce, I don't eat mine. Remember that? Really decimated with the lemonade. So I was pouring nuggets. I was like, okay, probably me. All right. I'll get your business card. Good morning, guys. If you will go ahead and put your name and email address in the chat box. We have quite a few people still fixing their plates, so it'll probably be a few minutes before we actually start. So give us just a few more minutes, please.
Hello, people who are online. Welcome to the coalition meeting. We're going to get started. Tabitha will be in here in just a second, and we're going to make introductions first. So really quickly, we'll go around the room, identify yourself. My name is Jessica May. And Camp Rain and also Journey Church. And we want to welcome you.
Make sure when you introduce yourself to speak very loudly because our speaker is up here. We want online to know who's here. Barbara King Ladd, Tempora Family Resource Center.
Eric Van Zant, Tempora Family Resource Center.
Cindy Smith, Tempora Family Resource Center. Rebecca Davis and Jay Davis with Neighborhood Outreach.
Angie Fuller, County Commissioner. Kathy Pack, Franklin County Library and Salvation Army.
And Gardner, County Highway.
Eddie Daniel, County Councilman.
Liz Austin Ward, Winchester Downtown Program. Amy Davenport, Tennessee Department of Health. Madison Wood, intern at Camden.
Ruben McCullough, Franklin County Community College. Max Tucker, intern at Camp Ryan.
Valerie Trimble, intern at Camp Rain.
Mason Tabor, intern at Camp Ray.
Jessica Rathley, Community Health Worker, Partners for Healing.
My name is Michael Mullis. I run back in the 5 Veterans Outreach.
Desiree Mullis, the Pullman Healing Project. Martina Cottle, also with the Pullman Healing Project.
News Director, Sam Stone.
Brianna Hayes.
Sid Fulmer with Blessings and Kiwanis.
Christy Shaw with Decisions, Choices, and Options, and also Life Choices. Pat Brandon Steen with Wings of Hope, Widows Ministry, and Winchester First United Methodist Church.
Will Taylor, Faith-Based Community Coordinator for Middle Tennessee Department of Mental Health.
Alan Burnett, Lifeline, also the coalition.
April Wilkerson, and I'm with the New Haven Baptist Church.
Rachel Swaffer, Tennessee Department of Health.
Dana Brown, Youth Services Director at Franklin County Library.
Jesse Sheehan, Director of the Prevention Coalition.
Tabitha Curtis, Tennessee Bureau of Investigation, Tennessee Alliance for Drug and Danger Children, statewide coordinator.
Melanie Morrow, Franklin County Prevention Coalition.
I'm Sophia Leon Meza, Health Educator for Franklin County Health Department. I'm Paula Rhodes, I'm with the Prevention Coalition, and I'm the Bridge Coordinator.
Rowan Wiley, I'm the Vista Prevention Coalition.
All right, well, thank you so much, and thank you for everybody coming out on this beautiful day, and everybody online. Who do we have online? There's Fancy Kilgore. You want to introduce yourself?
Hi, I'm Fancy Kilgore. I work at Health Connect America in Deckard.
Okay. Angie Caulfield.
I'm Angie Caulfield. I work for the Franklin County Health Department with the Chant and CSS program.
Dustin Ritchie.
Hey, I'm Dustin Ritchie. I'm a Regional Overdose Prevention Specialist, Region 5 South, based out of Franklin County Prevention Coalition.
Okay. Haley Colvin.
Hey, I'm Haley Colvin. I'm Health Department Director for Franklin, Grundy, and Marion County Health Departments.
Okay. Kelly Ware.
Hi, I'm Kelly Ware. I'm the Healthy Development Coordinator from the Southeast Regional Health Office.
We have Laurel Stone on. We know Laurel's driving, but Laurel Stone. Okay. Megan Ackland.
Hi, I'm Megan Ackland. I work for Department of Human Services in the Vocational Rehabilitation Program here in Franklin County.
Mandy Easterly.
I am Mandy Easterly, Health Educator for A Step Ahead Chattanooga.
Marianne Christian. She texted in. Oh, she texted in, okay. Ms. Patricia Burke, Jill.
Hi, Patricia Burks Jelks with the Franklin County Faith-Based Recovery Coalition.
Okay, I think that's everyone that's joining us via Zoom. All right. So thank you all for your participation today in the meeting. And again, welcome on this beautiful day to the Kampora Family Resource Center. So in front of you, you had the minutes from the last meeting. And they also probably, I think will probably send out to you with the invitation to the meeting. So if we could take just a moment to look over those minutes and also have someone make a motion to approve them, we'd appreciate that.
I'll make a motion to approve the minutes.
Okay. We have a motion from Jessica May to approve the minutes. Do we get a second? Have a second? Okay. All right. Sophia, are you going to give the community health assessment and survey results?
Yes. So I wanted to kind of give you guys an update of how we are doing with the survey. We have been, as you guys know, we have been really busy setting up at all of the events that are going on this past few weekends. We have not input the ones that we collected this weekend, but as of last week, we have a total of 366 surveys. Now, for our county this big, the number is low. However, we are not the only ones. The other counties that are also doing this, they're struggling to get to 300. So I have asked Jesse if we could extend it maybe one more week since Time to Hog was this past weekend and will continue on until the following weekend. If you guys have any events that are coming up or anywhere where we can do surveys, please let us know or help us out. We'll give you the surveys. All you gotta do is help us to get people to fill it out. Okay. Now, I'm going to go into just some detail about our survey. For those of you who don't know, we have been working to do a community health assessment. This will help us determine what are the top 3 issues in our communities that we're having. And also it will help us determine, all right, so now that we have identified these issues, how do we work to better those issues in Franklin County? So, we've been, what is this, month 5 that we've been working on it? Yeah, this is month 5. And hopefully by our next meeting, we can basically compile all the information and then choose our top 3 issues. All right, so far from our survey, this is what we have. All right, so when it says your age, what is your age? The lowest values have been 12 and 17, and the highest values we have is 87, 84. So that's how it's been ranging. What is your gender? About, I want to say 82.5% is female that has taken our survey, and then 16.7% has been male, and then about 0.8% prefer not to respond to that question. When it comes to what is the highest level of school that you have completed, 1.6% is less than high school diploma. 25.2% said high school diploma or GED. About 10% of our population that has taken the survey says they have vocational training certificate. About 15.3% have an associate's degree. About 24.7% have a bachelor's. And then about 21.9% have a graduate degree or higher. And then 1.1% prefer not to answer. What is your race or ethnicity? We have 1.1% American Indian or Alaska Native, 0.6% Asian Pacific Islander, Black or African American is 5.0%, 2.2% have been Hispanic or Latino, 90.4% is white, and other or prefer not to answer was 2.2%. Zip code, the majority's been from here. There's been 2 or 3 from like Fayetteville or Coffee County, surrounding counties, but not a big deal. The majority has been Winchester zip code. household income, there's a question on there about household income and about, let's see, so 14.4% was less than 25,000. 24.3 is 25,000 to 50,000 range. And then 18% that took the survey, they make between 50 and 75,000 a year. 75,000 to 100 range, that was 18.8%. And then we had 4.1 that preferred not to answer that question. Obesity, okay, now that this is gonna get into the vital signs that we have on that survey. So on that survey, we have 12 vital signs that came from Nashville, from Department of Health in Nashville. The first one was youth obesity, and we have about 46.7% of people that took the survey, they think it's a major problem. 45.3% think it's a minor problem, and 8% does not think it's a problem in our community. And then we go into physical activity. 54.1% think it's a major problem in our community. 36.3% they think it's a minor problem, and then 9.6% think that it's not a problem in our community. Youth nicotine use, we have 59.6% think it's a major problem in our community. 32.2% think it's a minor problem, and 8.2% don't think it's a problem in our community. Drug overdose, this was very big. I don't know, I guess we've seen it more. 76% of the people that took the survey think it's a major problem in our community. 16.9% think it's a minor problem, and then 7.1% think that it's not a problem in our community. Infant mortality, we have 11.3% think it's a major problem. 47.4% think it's a minor problem, and then 41.3% think that it's not a problem in our community. Teen births, 28.9% think it's a major problem. 51.5% think it's a minor problem, and then 16% think that it's not a problem. Community water fluoridation, the biggest ones were minor. 46.4% think it's a minor problem, and about 43.7% think that it's not a major problem. There's not a problem at all. Frequent mental distress, this was another one that I saw that was pretty big. Major problem, they think it's a major problem. We have, that was the percentage for that was 57.4%. Minor problem was 34.2%, and then if they think that it's not a problem, that was 8.5%. Third grade reading level, it was 50-50. We have 41.5% that think it's a major problem, and then 40.9% that think it's a minor problem, and then 17.6% they don't think it's a problem at all. Preventable hospitalizations, the majority said that they don't think it's a problem, or it's a minor problem in our community. And then not a problem was 18.6%. Per capita personal income, 46.2% think it's a major problem. 43.1% think it's a minor problem. And then 10.7% they don't think it's a problem. Access to parks and greenways, 20% think it's a major problem. 35.8% think it's a minor problem. And then 43.7% they don't think it's a problem. And we have, we have a lot of greenway areas. I think this would be just a matter of promoting more of, hey, this month, let's promote the team sport area. So that's what this one is access to parks and greenways. Adult smoking, so 57.7% think it's a major problem. 31.3% think it's a minor problem. And then 11% of the people that took the survey, they don't think it's a problem at all. Adult obesity was a big one. 73.1% think it's a major problem in our community. 22.5% think it's a minor problem, and then 4.4% think that it's not a problem in our community.
What was that percentage that thought it was a problem?
That it was a problem, a major problem?
Yeah.
73.1%.
Thank you, sorry.
Is one of our big ones. So far, the ones that have been in the 70s, it's a major problem. It's been overdose and adult obesity. Oh, and youth obesity. Neonatal abstinence syndrome, 21.5% think it's a major problem. 48.1% think it's a minor problem. And then 30.4%, they don't think it's a problem. Educational attainment, 39.1% think it's a major problem. 45.1% think it's a minor problem. And 15.8% they don't think it's a problem at all. Diabetes in our community, 50.5% think it's a major problem. 40.4% think it's a minor problem, and 9.0% think it's not a problem at all. Immunizations, 18.2% think it's a major problem, 47.8% think it's a minor problem, and 34% think that it's not a problem at all. ACEs, or adverse childhood experiences, 44.1% think it's a major problem. 41.3% think it's a minor problem. And 14.6% think that it's not a problem in our community. Heart disease, 53.3% think it's a major problem. 37.9% think it's a minor problem. 8.8% is not a problem. Cancer, and that is a generalized cancer. It's not just a specific type of cancer. But this is just in general cancer. 60.7% think it's a major problem. 31.6% is a minor problem. And then 7.7%, they don't think it's a problem. Uninsured rates, 54.9% think it's a major problem. 34.1% think it's a minor problem, and then 11% think that it's not a problem at all. And then after that, the survey goes into, at the bottom portion of it, it goes into what do you think are the top three? From the ones that you rated it's a major problem, pick your top three. And those we got to, they got to pretty much write it in. There was a lot of mental health. There was a lot of suicide. That a lot of people that said suicide was one of the top three. There was a lot of obesity. There was a lot of government. I think it was governmental help towards low income families. What else was the biggest? That's the ones that I saw the most on there. Addiction was a big one. Overdosing was a big one. And then what else? Let's see if I got all of them. Okay. And then it goes, at the bottom, it just tells you how many people completed fully the survey. So that's where we are at with the survey. If you have not taken a survey, we're going to extend it one more week, just to see if we can get, I don't know, 100, 200 more surveys. Because what I want to do is come back with that data and show you guys what is our community thinking is our top three issues. And we don't just want to hear from white females. We also want to hear from African American females. We want to hear from all ethnicities and then age too. I think there's a big gap on our survey. If you look at it, we're missing some areas in our community.
And this is why it's so important that we get the full demographic, because our demographic is not matching our community's demographic. Now, I'm looking through the survey and I'm like, oh yeah, this aligns with exactly what I see and what I feel. Well, of course, My demographic is well represented here. But we might be missing something huge if we do not actively go out and get the demographic we are missing. The problem is, how are we going to do that?
Can you give us the age brackets again, please?
Of lowest value. Oh, and let me tell you what, we found, yes. Remember at the very beginning, we did not want to do youth because we needed a special permission. I think it's RIT or IT. Now the Department of Health has gone away with that. For this specific survey, we can give it to youth as long as we're not forcing them. It's got to be voluntarily done. So I don't know how many we can get to complete this course.
Fill this out.
You have to know. But, like at the range. Don't give them the piece until they take the survey. So the lowest value that we have is been 12 and 17.
Do you have an average, a median age?
Yes, the median is 48.
The reason why I asked that, because NAS, and I'm not sure, I took the survey, but I can't remember how it was worded about NAS, and that we had a percentage of 41.8% did not think that NAS was a problem. So I guess my question on that is maybe how it's worded, and are people familiar with what NAS even stands for, or have an understanding of it? So.
And let me tell you guys, at the one-day event this weekend, we had a lot of people that came through. There was a couple that they didn't know what per capita income was.
Yeah.
And so I literally had to explain to her, she was probably in her late 20s. But some of those she didn't know anything about ACEs.
Yeah, I can't imagine someone not, I can imagine someone not understanding what neonatal abstinence syndrome is. They don't have a clue, so they just mark that, it wasn't a problem.
Right.
And if we look at, reading levels an issue, then we probably need to look at how our surveys worded.
Yeah, definitely. Anybody else have questions for Sophia? Yeah.
But we definitely want to get those areas that we are not getting. The people that have told us no to the survey, but they have agreed to at least do a poster with the QR code where people can just scan it and take it. I've been giving it out as everywhere I go, even if it's with my little one or with my family, I'm always like, can you please help us put this up on your billboard and help us get more survey responses. I can tell you we have posters or the surveys at Tepro, Nissan. The local library's been helping us a lot. We did the Every Door direct mail to Belvedere, Huntsland, Sherwood, Estill Springs. I think that's it. Yeah, Swanee too.
We're gonna be at High in the Hog.
We were at High in the Hog this weekend.
We're
We'll
gonna
do
be
it
there
again
again.
next weekend.
We're gonna be there Saturday with the Stashaway trailer, so if we have some volunteers that wanna come, and because we won't be able to do the survey, because we're gonna be busy with the trailer, but if we had a volunteer that set up a table from 2 to 7, we could probably capture quite a few.
And Melanie has some now, paper surveys she can pass around. If you haven't taken them, please go ahead and do that while you're sitting here.
Yes.
You live in Franklin County, right?
Yes, and let us know if you need posters, or if you need hard copies of the survey, we'll be happy to bring them to you. We've given them also at the jail, Health Connect.
Hey, Sophia, I just wanted the input, so a lot of the people, because I use them, like when I'm out in the community or what have you, a lot of the feedback that I'm getting from people is they don't feel like their opinion is gonna matter, so why should they fill it out? So trying to empower people that their opinion does matter. I don't know how we can do that, but I feel like that's a lot of the feedback that I'm getting. My opinion doesn't matter. Why do you need me to fill this out? They're not gonna listen to me anyway. So just trying to educate them on your opinion does matter. This is why we want you to fill it out, because if you voice your opinion, then maybe we can, implement a change or what have you.
Okay.
But that's been a good majority of the feedback that I've gotten when I'm out in the community.
Okay. I wonder if we could get local, do you think local leaders will help to empower some of our, community to take the survey?
have a solution to suggest, unfortunately, not in our world, but Sunday's the most segregated day of the week. And so the pastors of all the local churches, those that are African-American churches, Hispanic churches, we could ask them to pass it out to their congregation and fill it out. That way we would be able to reach that demographic at your.
And that was one of our areas. I'll tell you where we're having the trouble. We can leave it in their front door and but there, a lot of people, I feel like what I've come to, it's been hard for me to find them during the week. Unless I make my rounds on the weekend, on a Sunday. And just go, I don't know, church to church or whoever's.
You have to be there before, immediately before or after in order to get in. You know, churches aren't staffed anymore. We even with mailings, we get most of them come back.
If I could get numbers, maybe for like the priest or the preacher's number or whoever's in charge of the church, I'll be happy to call them. It just makes it a little bit hard for me on a Sunday when I've got my family as well, but I'll be happy to, as long as somebody's there for me to go talk to them. Or, I mean, if you guys already are going to a church on a Sunday.
Bring surveys.
Yeah, just bring surveys.
We're having a faith event on the 9th of June,
June 9th.
that's geared towards the congregation. the
Okay.
community, so that would be a good opportunity.
So be all from just Franklin County, right?
Yes.
Okay.
Pushing it back a month.
Yeah, that'll be pushing our,
We can't move forward with this is done.
I mean, we don't really, other counties are closing it out right at whatever they get and that's it. But the more opinions that we have from our, not just this room, the more opinions that we have from members of our community, I think the better. Like I said, about 90% of people that are taking our survey is white females. So I would love to hear from others and see what they would.
Have y'all done like listening sessions? So that's where one person kind of interviews a group. So I know in like, in county, like with some of the churches, they'll have one person that's representing the health council to go and do a listening session, you know, like with the senior group or, you know, Mother's Day out moms or, you know, things like that. So, and then that way you've got them right there, tell them what it's about, and then they fill it out before they leave. So that's been a good way to, you know.
To get more.
To capture more.
More diversity too.
Sophia,
Huh?
I think too with the churches, at least I found it this way, the best way is to go through individual Sunday school classes. Usually those classes take attendance, so that can keep up on their people in Sunday school class. So what I did was I just wrote out a little blurb about what it was all about, put that many in the attendance, and had really good results. If you tried to do it during worship time, I think it gets complicated. So I would suggest if anybody, you know, has a church with Sunday school class, not all
Go ahead
churches
and-
do, so
yeah.
you can't do that. But if you do have a Sunday school classes, you know, just take it to that class and, you know, it only takes like 2 minutes. to
Yeah,
fill it out.
it doesn't.
So I made that in bold. It takes 2 minutes.
Yeah. Yes.
And that would be a modified listening session. So
Yeah.
that's
So I'm open. If you have a church or you run a church and you want me there to be on your Sunday school, whatever program you have going on, I'll be happy to. We'll just have to, I really wanted to get more than 366 responses so that we could have a better understanding of what our community wants changed. So, any other suggestions are welcome. I won't take more time.
Whoever will bring back the most surveys next coalition meeting gets free lunch.
And
Get out and start working.
I will watch.
And before I sit down, I did want to thank those of you that are helping us with this or have been helping us for the past 5 months. We really appreciate you guys. because, I mean, it's been hard. It's not just our county though. It's some, the other counties that are struggling too to get survey responses. So, but for those of you that are helping us, I really want to appreciate everything that you're doing, and thank you, thank you.
Okay, did you decide to extend it past the 1 week?
Let's, yeah. we'll decide on that. What do you guys think?
Who thinks we should extend it for another month?
Raise your hand. We can see it.
Okay. I would say that's majority.
You want to set a deadline?
Would anybody like to sit up at Walmart and do surveys?
Or any of the. So when do you guys want to close this? You said June 9th was the next thing?
Right, yes, ma'am. I guess out of ignorance, what's the data used for?
We're gonna use this to determine what areas we want to focus on so that we can come up with an action plan as a group, so that we can work on creating, focusing on these issues.
Okay. So I know the faith-based event is on the 9th. That Saturday is the 11th. Do y'all want to do, just close it out on Saturday? And then we will have, they'll give me about a week to do my reading presentation and bring it here on the 20th. June 20th is our for that month, that will be our time. Okay, so we'll close it on the 20th.
Sounds good. All right, Jesse, do you have the coalition updates that you can give us?
Okay. All right, so we've got our newsletter. It's got a lot of information. We do that every month, so make sure you read that, you know everything that's going on. I get the platform. I have a few minutes. I have two problems. The first one is gonna be short and sweet because I don't got time for it. But there are these things out in the community that's being sold as disposable vapes. Nicotine, liquid nicotine is considered an acute hazardous waste. Explain to me how that is disposable. We are throwing that in our trash can. That's a problem. Also, these vapes operate off a battery. Also, not something disposable. We cannot throw batteries just into the trash can and do that safely. So we are throwing away on a disposable item an acute hazardous waste and a battery. So I have a problem with that. There is no solution. I would offer you the solution. There is not one. So I am working hard on trying to figure out what are we supposed to do about this problem, because thousands of these are sold every day. And we are throwing them in the trash can. They go to the trash can, they end up in the landfill. They go to the landfill, they end up in our water table. No, thank you. I have a problem. I would really like other people to start talking about that problem, because that's a soapbox of mine. But that's just a little blip. Definitely proud I got off my soapbox. She's starting to hear about my problem. I know, right? Because I'm fed up. I am fed up. I am done. I am over it. I am tired of losing people to the F word. Fentanyl. We are fed up with fentanyl. Anyone here tired of seeing people overdose? Do you guys understand how many we have lost in Franklin County this year? We don't even get the correct data for me to give you that number. It takes so long for us to get that information, and so much of this is not reported correctly that I can't tell you the overdose rate in Franklin County. I have a problem with that. I have a problem with our communication, and I have a problem with what I can do about it. And I have a problem with young people not understanding how deadly fentanyl is. I am not law enforcement. I am not trying to get this from a criminal aspect. I'm gonna let the experts deal with how we're supposed to stop that influx. Meanwhile, I have a community health issue that we have got to talk about, and no one wants to talk about it. We have got to get out of our silos, and we need to start talking to each other. We need to start spreading the word. I think everyone in this room and online is aware that substance misuse is not a moral failing. This is a disease. I think everyone here understands that recovery is possible. It is a reality for many people. And it's something that all we need to do is recognize somebody in pain and reach out and be there. This is not a problem that we can arrest away. This is not a problem that we can policy away. The only thing we can do is be aware and love them through it. And I need more people to stand with me and talk about it. Because we have got to get past the stigma. Until we get past the stigma, we're not going to be in a place of healing. Until we can get out of our silos and start working together, we're not going to have a solution. And what that looks like is, and I understand, we all have rules, regulations, policies. I get that. I'm not asking for state secrets. But if I can't tell you what I know so that we can work together to have the solution, my hands are tied. If you can't, as coalition members, and I'm not placing any blame, I don't think I'm yelling at you, I'm just getting passionate. You know, as coalition members, how can you work this into what you do? I'm going to use the library, who has been such a wonderful partner, and this is what this partnership looks like. What do? They work on getting people to read. Their work is literature. So how do they partner with us? Oh, we can put our information right there. We have programs we do together, like the coloring sheet. We engage families together. Town of Huntland, that's another great partner with us. How are we doing that? Are they changing anything that they're doing? No, we're able to put messaging on the back of a water bill. Okay? When it comes to partnerships, it's not about asking you to do more. It's about including what we do with what you do. And until we can do more of that throughout the community, and not just people within this coalition, organizations together talking. Right? I know we have HIPAA. I get it. I'm not asking for medical data. But if I don't know where an overdose occurred and how many has happened, then I can't get to those areas with the support that we have. I can't say, Ellen, I need you to go to the west end of Decker, and I need you to set up, and I need you to strengthen the rooftops that we are here for them. I can't do that if I don't know where I'm going. And me finding out 3 months from now isn't helping. But we have to do something. If the definition of insanity is doing the same thing over and over again and expecting a different result. Y'all, I'm crazy. I admit it, but I am not insane. I will continue to try something new until we get something that sticks. But how are we going to reach the people? Mid-20s to mid-30s. That is our target. Actually, it's early 20s to mid-30s. Those are the people that we're losing. Do you understand that that age group is our next generation of leaders? And they're not going to be here. I am scared, I am frustrated, and I am fed up. Who's fed up with me? We are having a town hall on, Alan, give me that date, June 23rd? At the high school. We just got that location confirmed today. Time is probably going to be 6 o'clock. I'll let you know, because we are still planning this. And in that meeting, we want to educate the public as to what the dangers of fentanyl are. We want to educate partners on what they can do about it. We want people to hear what the real problem is. And if you want to be in on that planning committee, we are having it right after this meeting at 1 o'clock. Okay, this is a real problem. This is not something that we're hearing about in the news that affects Nashville. Oh, it's over there in Memphis. Oh, it's all up there in Atlanta. That's California. Y'all, it's happening right here in Franklin County, Tennessee. And what is so frustrating is we saw it coming. There was a map on the wall, and it was headed with arrows straight to us. And we've been saying, it's coming, it's coming, it's coming. Y'all, it's here. And people are dying. Please come to this meeting. Help be a part of what the solution needs to look like, because I don't know what it is. If I had the solution, I'd give it to you. But the only way we're going to tackle this is if we work together.
You know, Ms. Jessie said the target area is early 20s and 30s, right? And that's bad. Would you all agree? Well, what if you looked at it as, let's say, 1 year old early 30s. Can you imagine that? You guys think that happened? Can you imagine a 1-year-old child overdosing and dying? How well does that sit with you guys? Are you okay with that? It happened. Probably 2 weeks ago. It happened. And this child got their hands on their parents' drugs, put it in their mouth, and overdosed. Just the other day, we had 5 people in one day overdose. In one day.
Spread out or from the same.
In our county.
In our county, in this county, in one day.
And that's
this-
becoming the new normal, by the way.
This is happening every day. Are you guys good with that? I mean, we all talk about who we are as a person. But are we really who we say we are? Are we really going to continue to allow things to come into your home, because this is your home, to kill your family?
I think it's important to add that that's exactly what's happening, because drug dealers are using social media to sell counterfeit pills to youth, specifically targeting youth because they know they're easy to target, right? So
This is what's happening every single day, and it's only getting worse. It's about to get really, really hot outside. And people are going to start participating a little bit more. People's tolerances are going up, so they're gonna start using more. The demand for it is going to become more and more. So we say we want things to change, but what are we? Not somebody else. What are we? What am I going to do about the things that's coming into my community, into my home, that's destroying my family? And if you don't know what's happening, then get educated. That's why we are here. Stop being afraid to talk to your kids, your family members about the things that's happening out here. Because if you don't talk to them, somebody else is, and that somebody else may not educate them properly.
Can I ask a question? What kind of harm reduction is being provided? Like, where can people get fentanyl test strips? Like, where are those services?
So the fentanyl test strips was something we weren't allowed to buy. It was considered, what's the word, paraphernalia. That has just passed, so we can do that. Our grants have not yet allowed us to do that. I don't know if our grant money will. They're working that up above my pay grade.
The Center for has applied for a grant, and if we get it, we start in September, it would allow for funding for that. So
that would be good.
keep that posted.
That's gonna take a little minute. What I'm looking at is right now, that's what I'm looking at. Is because these overdoses, people dying, kids participating and reaching out into these vapes, these gummies, CBD and all that, that's happening right now. And we all know that it's dangerous. We all know that it's destroying our communities. This right here in itself is harm reduction. We got to stand up and do something. We can put all of these things in place. We can put test strips out here, and I'm getting on mine right now. We can put these test strips out here and all of that right there. But me being an addict and I'm fainting for my dope, I'm not putting my dope in that test strip.
what if you have it, you will?
No, I won't.
You're wasting.
No, that's not gonna happen. Mm-mm. No, if you got an addict that's been out here on this hard dope for years, and if they don't get their dope and they're bowled over and they're sick, they're throwing up and messing on themselves, they're not gonna get rid of that dope.
Now, our biggest harm reduction is the Tennessee Save a Life with going out and giving education on overdose awareness and providing naloxone in areas that need it. So we have the first year and a half, 2 years of that program, we did a lot of agency training. Right now, our focus is on getting into areas where they're actively using and giving education there.
And they are working on getting something, for harm reduction, with that grant. But seriously, what are we gonna do?
I'd like to say, again, something you all need to be thinking about, and us as community members, is something this coalition's been looking at for years. And I know Miss Angie Fuller, you've been around here for years, when I was like Jesse on my soapbox, talking about the convenience stores and that convenience store dope that's out there. Well, now that Zaza Red and all that, it's killing people. And the kratom that's being sold in these tobacco/smoke shops and the buds and all the CBD buds and all that. You know, we now have restaurants who have beers and buds, you know, beers and brews or brews and buds or whatever. You know, it's just social grooming our society to accept substance abuse issues. And, you know, already coming into a situation of where we're seeing families already impacted by, you know, years and years and years of substance use disorder that's destroyed families and children. And, you know, on here, on the survey, it talks about, you know, ACEs. You know, most people don't even know what ACEs is when they're looking at this. And this is adverse childhood experiences that these kids are dealing with. And we as adults have had to deal with over all the years of our lifespan over things that were in our homes. Alan, you mentioned that 1-year-old that overdosed. You know, we're seeing that more and more with the children, not only across the state of Tennessee, but across the United States, where they're finding them either overdosed or they're in the back seats where a family member's overdosed, or they're walking around the park because a parent is overdosed in a city or whatever. But, you know, we're dealing with the adverse childhood experiences. We're also dealing with what, you know, people don't know what NAS, you know, I know, Dana, you looked at me and like 41% don't think that's a problem. NAS, you know, neonatal, you know, the new term for NAS is neonatal opioid withdrawal symptoms. You know, people understand a withdrawal symptom more, I think, than an abstinence syndrome that these children are dealing with. So again, I think Alan, Jesse, you all coming up with the IM and then the fed up, and definitely fentanyl is the F word, but it's not the only F word that's out there. I love that it's the F word and that people don't want to talk about it. You don't want to hear the F word. You know, I don't care. I don't want to hear the F word, but you know, fentanyl being out there, but methamphetamine is back on the streets. It's pure, it's potent, and people are dying from it as well. So whatever the drug is out there, whether it be the methamphetamine, the fentanyl, or the heroin, you know, it's out there. And Alan, I agree with you. People aren't going to take the time to test their dope. They want that dope. They want it in their arm. They want to take it. They want it out there. So again, coming to this town hall meeting, I will be there. I want to support the coalition in that, and whatever is what you're going to do to educate the community. And I would definitely, for all the people that's on the Zoom meeting today, I would recommend that, you know, because this is now an option, that it also be live streamed, so that there's options for people to see it either live stream using Zoom or Facebook, but also to fill those seats out there that night, and for people to say, you know, what can we do to come together?
To end on a good note, I got this today. I might be able to read it right now, but this right here is from a young lady that had overdosed last year, about a year ago, probably a year ago and a few days last year. But a year ago, I had no will to live, and I would give my body and my soul for something that would make me numb. 1 year ago, I got on a plane with 5 outfits, 2 pairs of shoes, a sketchbook, no phone, no earbuds, no entertainment. It's been an entire year, and I have such to thank for that. Choosing between something that sounds like a short, fun time and your family appeared super hard until I finally had to make the choice. This year, I have met so many amazing people who have shown me how to grow out of the small town mindset. Here's to 1 year sober off of all mind altering things. That's what we get, y'all. We get life whenever we step up and do for others for what they can't do for themselves. And it's time that we actually stand up and do that, because some of these people, when they're lost and they're so far down in the hole, they're reaching out for us, and all that we really do is we walk past them. And I know what a lot of that is. And it's not so much the addicts that's in that hole too, but it's us as society that's in that hole. And the reason why we don't want to tap in and reach in to grab those individuals and pull them out of that hole that they're in, that darkness that they're in, is because we're dealing with our own mess. Because a lot of us are too afraid to look deeper or deeply within inside of ourselves. And until we start doing that, we're not going to heal. You're not going to heal. So everybody in this room has really got to be fed up with what we are allowing to happen, not only to ourselves, but to other individuals also. I mean, that's what it's all about, is love.
In my community, the problem I'm having right now, I don't think any potatoes are in here, but these people, the potatoes, all of them, they're like snuff potatoes, they're buying, they bought in 2 of those stores in my area. They've got stuff that, the other day I was standing there reading one of them. It's unreal what all they've got that they sell in that store. And I can't see that our law enforcement is for that or whatever. And I said something to one of the guys about it. He looked at me like I was crazy. He said, make a money, just make a money. I said, well, you know, you got to do it the right way or the wrong way. Oh, just make a money.
That's just called a legalized drug dealer.
Yeah, and
Yeah.
I've got
Yeah.
both of them now in my community that I'm having a problem with. And they're going out and buying these stores everywhere. And I mean, I don't know what to do.
Well, the Zolzol Red is on track right now to become a substance, that's gonna be also, I forget what is controlled substance, it's gonna be a controlled substance.
That's huge news. Like that became, a controlled substance in Alabama where they couldn't sell it. And so that's where we saw a big influx here because they just started to us. But people are overdosing on it. So that's a good win. The problem is the laws take a long time to change and the formulas on these chemicals are not so slow. So they always stay a step ahead. So until we can get some kind of big, just a big umbrella thing, which is very hard to pass legally, it's really about education and letting them know, hey, you're not gonna get my business.
And just let them know when you go in there. I mean, I used to do it all the time. I don't frequent that many convenience stores, but when I would go in there, I would say, this is trash. You're selling this to our kids. You don't need to be putting this up here where these kids are checking out. I go back to the old days of the lazy cakes. Remember those little chocolate brownies that were selling at Fred's? Back in those mind altering things, tried to eat a couple bites off of it, not to eat the whole thing. So we're going to go ahead and wrap up for I know everybody's here on their lunch hour, and we definitely appreciate you participating and being part of the coalition meeting. We have, Jesse's got the remainder of updates for the coalition, that you have this in your packet. Is there anything else from Health Council, Sophia, that you needed?
If you want to participate at the back to school event, let me know. The date for that is going to be July 20th. This is where we pretty much collect school supplies and give them that day to the kids. So July 20th, back to school event, we're starting to collect school supplies. Let me know if you would like to help. If you want to set up as a vendor or your organization needs, if y'all want to come, that's fine. All we ask is that you bring in school supplies to donate.
Again, look under the announcements, upcoming Zumba classes at the Rain Teen Center. Isaiah 17 is needing volunteers. We mentioned about the High on the Hog Festival is going to be at the Winchester City Park. So go out and support not only the Kiwanis Club with that event, but also take the survey while you're out there for the Health Council, and go to the Stashed Away trailer. And the library, of course, has events going on, I'm sure all summer long.
A huge summer ending on July the 29th at the city park. We'd like vendors to come set your booths up and let everybody know what's going on in the county.
That's also the grand opening of the county's first storybook trail.
Oh, yay.
Yes, I can't wait for that. Yeah. Okay. Yeah, Barbara, you have something?
Yeah, I just want to add something. We're talking about the
fentanyl problem, right? And we want different people to come to the table and bring different perspectives. And I very much appreciate that Breezy mentioned the fentanyl test strips. And it may not be for everybody, but it is harm reduction and it is part of the solution. And maybe hardcore addicts that are vomiting and very sick off dope aren't going to take time to take their test. But people who are selling drugs might test their drugs, or recreational users might test their drugs. So it's just another piece to the puzzle. And there's lots of data that's been shown that it is effective in reducing harm. It's not the only solution, but it is a piece of the solution.
Yeah. I've done about 20, let's just give or take 20 alcohol and drug assessments maybe in the past 2 or 3 months. 7 of those people thought they were using something that was not fentanyl. I overdosed on methamphetamine. What did the hospital record say, right? And then we looked at the hospital records, it was fentanyl. They had no idea what they were taking. Or somebody who's been addicted to pills and then shared, well, I couldn't find any pills, so I got some heroin to store. It wasn't heroin. I did a drug test on them and that's not what it came positive for. So we went ahead and labbed it. So, I mean, I know it's not the solution, but it has to be a step in the right direction because some of these, and this was like younger folks, we're talking early 20s, that just don't know what they're getting their hands on. And, yeah, would they, I mean, I don't know if people would use them, but like there are people that don't know what they're using or really think that they overdosed on meth.
We've been asked for them. Are they legal?
Yeah.
Because they were drug paraphernalia. They are now, it just passed. Okay.
The ropes, that grant, what is the RITS grant? They're working on that.
Yeah, our SOAR grant is working on it. We are asked for them. I mean, when Dustin's up doing community outreach, that is something that they would like to have. I mean, you're right, it is a harm reduction.
I was in year 3 of my MAT grant. I had taken over from Michael Reynolds and Samson came and said, hey, like, are you offering these on site? And like, just not learning that I can, was at the Tennessee state law. It was something that we could, but it was already towards the end of our grant. I couldn't afford it. So regardless, I just want to know like what that looks like in our community. I would love to work with you and talk about where it would be most effective because that is a plan that I am wanting to implement within our agency. And obviously work with you guys to see where those are most needed, if they are. I mean, if there's another type of harm reduction we can talk about to put on the table as well.
Yeah.
I'm hopeful that we'll have a grant in September, which I know isn't now, but.
So right around the corner.
Okay, thank you all again for your attendance. The next Coalition Health Council meeting will be June 20th, 12 o'clock, right here, and that will be closing out our survey at that time as well, right, Sophia? Yep. Yes. All right, thank you all.
Can I ask about the calendar here? I was seeing something and I think it was in the newspaper. May the 19th at County Community